Thank you so much for the opportunity for us to share what we've been doing at Virginia Commonwealth University. We have been doing some innovative strategies for testing among nurse practitioner students. This is Dr. Leanne Breckenridge. Not speaking on this poster presentation is Stephanie Bork or Dana Burns. However, they did help me put the slides together and are collaborating with me on this project. So I'm going to talk to you about collaborative testing among graduate nurse practitioner students. This started approximately 3 or 4 years ago, right after COVID. And what we think happened is that we now have new learners and we're having to learn to adjust to their way of learning. But it was very disturbing to us that our students were not grasping the material. And we felt like it's very important, since they are becoming nurse practitioners, that they get some of this knowledge so that they can apply it to the state board exam. We do know that collaborative testing has been used in other arenas. However, there is no documentation that's been used in graduate nursing programs, or very, very little. So we thought, well, this would be a good time for us to try it out. We do know that benefits of collaborative testing from the research from other arenas is that there is knowledge retention, there is documentation of decreased test anxiety, and also increased peer collaboration. So that was a bit of our goal, is to get them to do all three of those. Our project aim, as you can see, is to evaluate student feedback after 3 semesters of collaborative testing in a family nurse practitioner course, actually courses, by way of a survey. We did these surveys at the end of the cohort, and what we did with the testing is that students would come in. They would have a scheduled test, as they usually do, and then they would come in, they would take the individual test. They were not able to look at the answers on ExamSoft. However, then we would randomly assign them to different groups. After everyone was finished with the individual exam, we'd put them in these groups, different groups each time, and then we would let them work through the test again. Exact same test, only they would be able to answer the questions as a group. Each person had to resubmit the test as a group. So if students didn't agree with the group, they could still put in the answer they wanted to put in. And sometimes they did do that, which was really interesting, because 9 times out of 10, the group was right and the individual was wrong. But it was very interesting to see that. After they did the individual exam and then they did the group exam, we would weight the scores. Depending on which course it was, would depend on the weight. My current course, we use 70% on the individual exam and 30% for the group exam. So what we did find is that it really did not elevate or make, inflate the grades much. The survey, as I already mentioned, was conducted after all 3 semesters of the courses. One of them was pharmacology, one of them was our maternal child course, and the other one was our complex health course. You can see the survey questions here. These were the top 3 answers, or the ones that answered favorably, so we put them in here. The entire survey was about 10 questions long. So what we did find out is that 70% of the students surveyed there were a total of 70%, or excuse me, 70 students surveyed from the 2 cohorts. The 2024 cohort scored slightly lower on the survey. The means were high on a majority of the questions asked, and there was a thematic analysis completed for the qualitative questions. So Stephanie and Dana and I did Duty's way of qualitative evaluation, and what we found out was that these themes stuck out. There was active learning. In other words, there was conversations with their peers. Testing mindset. It helped ease their anxiety when they were taking tests. Collaborative dynamics, which helped build them relationships. It was really interesting to kind of watch this from a faculty standpoint. You know, a lot of these students did not know one another, and as they work through these different groups doing these tests, it was amazing to watch how they were learning from one another and how they studied, the way they thought. And at the end of the cohort, even though we didn't evaluate this, I felt in my gut that these students were much closer than previous cohorts. And then test logistics, we had a standardized, clear process of the way we did it. In conclusion, we found that collaborative testing was feasible in nurse practitioner education. It improved the student and faculty satisfaction. And what I would say about faculty satisfaction, we found less students coming to us after the exam challenging us on questions and answers. Students still wanted to look at their exam questions and wanted to sometimes discuss the answers. However, I will tell you that it probably dropped about 75% of students that wanted to ask us questions or challenge us or meet separately with us. So we really did feel that they were learning from one another. And then also collaborative testing supports competency-based education. We found about 6 competencies that were met with our AACN new criteria, and so that is one way that we can meet those competencies. So if you need further information, feel free to reach out to us. We would love to talk to you about it. My email is breckenrill, BRECKENRIL @vcu.edu. Thanks so much, and hey, let's all be kind to one another. It's a tough world out there. Thanks so much.